Hello and welcome to part 4 of Oral Placement Therapy series. The 3 last components that we are going to discuss today are Z-Vibe, NUK brush and Oral SI kit. Starting with Z-Vibe, as the name suggests, it is vibratory, so helps in improving both tone and sensation. Where can you use it? On the gums, cheeks, tongue and lips. It is used for oral defensiveness. So if there is a problem in the tolerance of any sensory stimulation produced by spoons, forks, even brushes, or the texture of food, it is beneficial there. Also for improving biting, chewing, and even articulation during speech. How to use it? It helps in improving the awareness inside the mouth so that there is no overstuffing or pocketing of the food inside the mouth. It also helps in avoiding mouthing, a function known as pick-up, where the children tend to put inedible objects in the mouth which produce a choking or even a gagging and even some unhygienic things that can be put in the mouth. So you might observe your child chewing on clothes, putting different objects in the mouth, toys, just to avoid that. The second tool for today is NUK brush. It is a soft bristled brush. It is made of silicone and it is textured. It does not have any vibration like Z-Vibe. It is usually used for teething issues in infants when they have irritability, for reducing oral hypersensitivity in children, and for lateral molar ridge or stimulation of the molar teeth. If the child has difficulty in tolerance of texture, so before mealtime is a great time and you can use the NUK brush. You can dip it in iced water for a better calming effect. If there is a lot of sensitivity, it's not necessary that you have to start within the mouth, but you can try it more distally, that is away from the mouth. So you can maybe start with the cheeks or maybe the shoulders and move it towards the mouth slowly so that there is a better tolerance of the NUK brush. So on the face, move it towards the midline from cheeks, chin, then the upper lip area, and finally coming to the outer part of the gums. And if you find that the child or the adult has low tone, in that case, you can increase the pressure of application. The final component of the day is Oral SI kit. It is part of a pre-feeding program. It consists of one sensi, which is the main component on which different attachments, 12 different attachments actually are connected. It uses a normal 1 AAA battery. The 12 components include a Sensi Blue Chewy tip, which helps in improving biting, chewing, and jaw strength. The second is a Wee Chewy tip. So as the name suggests, Wee means used with children for the same functions of biting, chewing, even for tongue lateralization. Soft pointer tip. So it is pointed, so helps in providing tactile or touch-related cues at specific points or spots. Textured probe tip. As it is textured, so it helps in providing a sensory experience to the cheeks. You can use it inside the mouth, which is the buccal space. A side spoon tip, which is used more for the mouth corners and enhancing lip closure. The round tip is meant for lips, cheek, and tongue. The V-round tip is meant for infants below 2 years of age for improving lip rounding, for example, for straw drinking, etc. A soft spoon tip, which is also textured, helps in improving lip closure and sensory awareness. Pointed spoon tip helps in improving lip rounding, retracting the tongue in case there is a tongue thrust, and also awareness of the spoon, so helps in reducing any kind of sensitivity in the mouth. Soft high jaw helps in jaw grading from medium to low. And finally, the tongue depressor, which helps in lip closure, breathing through the nose, and also saliva management. Hope this series was informative for you. Keep following the channel for more information about rehabilitation and therapeutic techniques. Mention in the comments below if you have any comments or suggestions for me. We'll meet again soon. Bye.